Good afternoon. I'm Clint Cummins, CEO of the Memphis Medical Society. Thank y'all for joining us today with what is now becoming an annual tradition that we call Pizza and Politics. Dr. George Woodbury is joining us today. Also with us, we have Cara Azar, who is in a newly created role of physician liaison. I'm excited to have her with us, and producing behind the scenes is Allison Cook, our marketing and communications director. Dr. Woodbury has been our legislative chairman for a number of years now, and I try not to show favoritism to any of our members, but I can tell you that no one works harder on behalf of physicians than Dr. Woodbury. I'm sure he'll tell you at some point how many times he's been to Nashville and how many different meetings and coffees he's had with legislators. It's quite remarkable the amount of time and energy that he puts into this while owning and operating his own rheumatology and dermatology clinic with his wife, who's also a member, Dr. Kathy Chapman. So without further ado, Dr. Woodbury, I'm going to turn it over to you. Thanks for your time today. And one more note of housekeeping before we let Dr. Woodbury start. If you have questions, feel free to type them either in the Q&A or the chat feature. We're going to record everything except for that little gaffe at the beginning. Of course, we're going to edit that out before we record that, but we'll email it out to all the students. It'll probably be posted on YouTube as well. And so feel free to put your questions down in the Q&A or the chat feature. And Dr. Woodbury, take it away.
I'm honored to be here today. Can you all hear me from your side? I'm actually a dermatologist in Cordova, Tennessee, and I've been doing these Pizza and Politics forums for the medical center since about 2005. So this is about my 15th year of chatting with y'all for a few minutes about some of the initiatives of the Tennessee Medical Association and the Memphis Medical Society. I'd like to give you, in the next 15 to 20 minutes, a bit of context in what we're about with the legislative committee of the Memphis Medical Society and some of the projects that we've worked on in the past. There's one major project that the Medical Society is working on currently that you all as medical students need to know about now. And so I'm going to devote the majority of my time to that particular topic. But I'm just honored to be invited to share some of your time on the issue of what advocacy means in terms of organized medicine, particularly the Memphis Medical Society. So if you want to go on to the first slide, after this leading slide, let's see, if you go back one, let's see, if you go forward one. Yeah, this is my daughter, Emily Woodbury, in the middle there with my office manager. And essentially what brought me out of the woods from Cordova, Tennessee as a dermatologist into getting active with the Medical Society was back in 1999. I had two of my dermatology patients start lawsuits against my practice, one over alleged scarring from Accutane, which is an acne medicine, and the other over alleged lack of informed consent for a biopsy on her ear. And both of these lawsuits played out. No money went to the plaintiff, which is the person presenting the lawsuit. And I was basically carrying two active lawsuits in my earlier part of my career. And my daughter, who was active in youth legislator in middle school, Emily said to me, she's like, Dad, don't get mad, get active. So here I am 20 years later, still doing my best to remain active in terms. She's now actually graduated gynecology obstetrics at Cornell, and she's practicing in Manhattan as a gynecologist. If you want to go on to the next slide, the three topics I'd like to share with you today have to do with the story behind 21 for 12, the story of graduate medical education, which is our major topic of discussion today, and some comments on what's called physician-led team-based healthcare. 21 for 12 was an initiative by the state of Texas back in the late 90s, in a time when Texas's professional liability system was rather unstable with a proliferation of suits without merit. That means people were presenting lawsuits against doctors really more or less to try to get settlements out of those doctors, and there wasn't really a lot of meat behind those lawsuits. And the Texas Medical Association started a campaign that was called 21 for 12. 12 was a ballot initiative saying that it would be constitutional in Texas to have a limit or cap on what are called non-economic damages, which are what are called pain and suffering awards in lawsuits, which cannot really be measured. There's such a thing as economic damages and non-economic damages, and escalation in non-economic damages was contributing to a rapid increase in liability premiums for physicians. And the state of Texas actually passed that provision by about 51.5% to 48.5% back in 2002. And it's had a major effect in their state in holding down on what are called runaway juries and exceedingly large pain and suffering awards. And that was won mainly because of involvement of their medical students in this process. Each one of the doctors in the Texas Medical Association was asked to find 21 people to vote yes on Proposition 12. And the medical students played a major role there. And you guys can play a major role in our state of Tennessee as well, since we have a cap on non-economic damages, which helps to curb lawsuits without merit in the liability system. And I don't want to spend this whole amount of time on liability reform, but that was the initial issue that I worked on in Tennessee from about 2003 until we did have major reform in 2010 in our liability system. The premiums for liability insurance are a rather important factor for newly practicing physicians because they can be rather substantial. For instance, obstetricians may be paying something between $60,000 and $100,000 in liability premiums. That means you really can't practice part-time as an OB if those liability costs are so high. And since 2010 in Tennessee, the number of lawsuits presented against physicians has declined by 40%. As well, the liability premiums have declined by 40% in our state due to some of the reforms that are now in place in our liability system. So that's a theme which runs behind talking about advocacy in healthcare, because the ability of physicians to practice in a state is dependent upon the ability to find affordable liability insurance, and that's dependable upon a stable liability system. And that it was accomplished in our neighboring state of Texas by involvement of medical students there. And I know that because I talked to the director of the Texas Medical Association about what allowed them to achieve this constitutional amendment establishing the availability of caps for non-economic damages in their state. As well, in our state of Tennessee, we've had two challenges to our caps within the last several years, both of which have resulted in our keeping our cap on non-economic damages in Tennessee. What I'd like to say is that the major topic for today has to do with support for graduate medical education funding. And I'm going to save some of the time at the end to talk about physician-led team-based healthcare. The reason I put those three yeses on that slide for graduate medical education is yes, 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 we do need that in our state. If you want to go on to the next slide, there are about 2,700 interns, residents, and fellows approximately in Tennessee who are working in hospitals around our state, and their funding for their salaries comes through the four university systems in Tennessee, which are UT, Health Science Center, Meharry, ETSU, and Vanderbilt. So what happens is the funding, the check that the residents, interns, residents, and fellows get will read, for instance, University of Tennessee on it. And the money that pays for that check comes from Medicare, Medicaid, and the hospitals. And some of the money comes from money that the hospitals raise from taking care of patients right there at the hospital. So there's about 2,700 interns, residents, and fellows. There's 5 medical schools in Tennessee, the 4 that I listed above, as well as Lincoln, which is in Knoxville, which is an osteopathic school. Keeping those 2,700 interns, residents, and fellows requires what's called direct support and indirect medical funding. And if we go on to the next slide, I kind of elucidate on how that works. Those 2,700 full-time personnel cost about 205 million in salaries and insurance, health insurance benefits. The average debt when you graduate from medical school is of the ballpark of about $190,000. So my argument is, we here in Tennessee, all 6.8 million of us, depend upon interns, residents, and fellows for now and also for the future, because you guys are the doctors of tomorrow. And if we don't have you in the state as graduate, as PGY1, postgraduate year 1 to postgraduate year 9, interns, residents, and fellows, you may have a tendency to scamper off to New York State or Florida or California. So you're a hot commodity to retain you in our state. The way we retain you is having jobs that you can fill in these university programs, which are paid for by money that comes from Medicare, Medicaid, and the hospitals. And that money has to amount to the ballpark of about 205 million, somewhere in that category, for direct medical funding. So if we go on to the next slide. The problem, and it's elucidated in a letter which the Medical Society can send to people that would like to get the letter that I put together. But the problem is that sometimes people in leadership positions in Washington may not understand the importance of your being paid a salary when you finish medical school, and they may not remember that 190,000 average accumulated debt that comes about from getting to that point in your training. And they may say, well, maybe we just don't have to pay those interns, residents, and fellows. About 50 million of that 205 million comes through what's called Medicaid, which in our state is called TennCare. So TennCare is our Medicaid program in Tennessee. And the way that funding goes, 2/3 of the Medicaid or TennCare funding comes from CMS, the Center for Medicare and Medicaid Services in Washington, D.C. 1/3 of that 50 million comes from a tax on all of the state's hospitals that channels through TennCare in Nashville. So you got a 2/3 to 1/3 formula. So 2/3 of the 50 million, that's like 33 million, comes from CMS in Washington. 1/3 comes from Tennessee, from Nashville, but it doesn't really come from Tennessee's budget. It comes from a tax on the hospitals, that 1/3. The problem is that in January of 2019, our new governor, Lee, came into office, and as part of his budget presented a provision to boost that funding by $8.6 million through a rural health initiative, it was called. It did not require a 2/3 to 1/3 sharing with CMS in Washington. Well, as of about a month ago, it became clear that the administrators at CMS in Washington were very concerned about the fact that Tennessee was funding by itself through TennCare and not following this established formula, which has been in place since 1997. And actually, the established formula in and of itself is not the best in the world because it stays static at 50 million year after year after year. Well, you and I know that the population grows, and also there's inflation. And so keeping that flat was a flawed formula from the get-go. The problem is that the administrators at CMS in Washington have made a decision that they will stop funding the 50 million part of the 205 million total. They will stop funding the 2/3 that comes from them effective on July 1st of 2021. And I've talked to some people in medical education who have said maybe we should not discuss this directly with the interns, residents, and medical students because it might upset them. The reason I'm discussing it in this forum is because I think you deserve to know about this so that you can actually be involved in fixing this. Because when I did speak with one of the elected officials that's on this list, the staff member in that office, the staff member said to me, oh, well, this will be negotiated between Nashville and Washington, D.C., and it's almost like, don't let the rest of the world know that you know about this. And the reason I know about this is I've talked to a number of lobbyists, both here and in Washington, D.C. about it. I've been following this graduate medical education funding issue since 2012 at the behest of my daughter, who said, Dad, you need to be focused on the young doctors that are coming into training and not put all your efforts into liability reform. So here I am in 2020, but I became aware about a month ago that the administrators in CMS had made an internal decision that they were going to revoke that 50 million funding piece, which will have an unfortunate effect upon the 4 university systems. for the rationale for revoking that is, first of all, you boosted in Tennessee by 8.6 million without getting our permission. Second of all, we think that Medicaid is there for direct patient care, but not for training. Well, if you think about that for about 5 seconds, you're going to say, wait a minute. Graduate medical education is direct patient care. That's how interns, residents, and fellows learn how to be doctors, is by providing services. So we're splitting hairs here, in my opinion. This is just me talking, but I'm just saying, for the people at CMS to say they're not going to fund graduate medical education because it's funding just education, it's not funding patient care, well, they're the same thing, in my opinion. So the reason I highlighted these people in this list, if you live in Tennessee and vote in Tennessee, you have two senators that are in office on your behalf, which are our senior Republican senator in Nashville, Lamar Alexander, who is the chair of Health, Education, Labor, and Pensions, which is a very important committee, and he will be in office until January when he retires, as well as Senator Marsha Blackburn, who used to represent part of this Memphis metro area when she was a representative, and she's now a senator. With these elections that are happening on November 3rd, Lamar Alexander's seat will be replaced by either a Democrat or a Republican, but it's likely there will be a transition of information between those two administrations. So this GME funding issue problem, as I would describe it, is something that would be fixed a lot quicker if it were a priority of our two federal senators, as well as our two federal representatives from this Memphis metro area. Tennessee District 8 is Representative David Kustoff. Tennessee's 9th District is represented by Steve Cohen. Steve Cohen is a Democrat, Kustoff is a Republican. I have spoken with people in all four of these offices about this issue, and it's clear that they see it as important, but they don't really see it as urgent or very important. And the way I look upon it, you guys are going to be deciding what state you locate in for in the match in March, and your applications are, in process, if you're a senior medical student already. So what I'm saying, it would be a really good thing to my mind if particularly Lamar Alexander and Marsha Blackburn saw graduate medical education funding as a priority, and also if both Representative Kustoff and Representative Cohen saw this as a priority. And if you look at the economics of this issue, the Medicaid budget, the TennCare budget in Tennessee, is to the tune of about $13 billion a year. We're talking $13,000 million a year, and it grows by about $350 million a year. So it's getting bigger. But we're talking in terms of this Washington, D.C., Nashville formula, the Medicaid funding of GME, we're talking about $50 million compared to a total budget for TennCare of $13,000 million. Furthermore, the overall budget of the state is about $31 billion. And sometimes the elected officials don't realize how vitally important you are. If you're talking to Democratic representatives, you want to emphasize access. Having more doctors here means better access for patients to needed health services. If one's talking with Republicans, one talks in terms of jobs. Having a physician here, whether that physician works in the hospital, the OR, the lab, the outpatient clinic, on average, study done by the Tennessee Medical Association some years ago shows that we support about 6 full-time positions right here in our local community, not in Taiwan or in Japan, but right here in Shelby County. People that work as the secretary, the office manager, the technician in the lab, the nurses, all of these people's jobs are dependent upon having us in the state. So when one would explain why we need to properly fund graduate medical education to a Republican representative, one would tend to focus on, it's really important for me to complete my training in Tennessee because I can't afford to work for free and I want to be in this state, but I've become aware that there's a problem coming out of CMS in Washington with funding graduate medical education. So maybe we can move on to the next slide. The letter that Mr. Cummins could send you all has contact information and a suggested verbiage, but these are the people that need to hear from leadership as well as general membership of the medical schools now. They don't need to hear in January or in March. They need to get really well focused on the importance of funding graduate medical education, because Senator Alexander and Senator Blackburn could say, hey, we're going to walk over there to CMS and we're going to talk to the administrator about this now because it's important for our state. If we go on to the next slide, I also put a picture in here of David Kustoff and Steve Cohen, and these are all experienced legislators in Washington, D.C. It would be very helpful if it could be a bipartisan letter coming from our delegation of, from both the House of Representatives and from the senators to CMS saying, we want this to be fixed. If you think about this for just a minute, by the way, you know how I mentioned that $50 million comes combination Washington, D.C. and Nashville through Medicaid for our state? If you think about it, if you look into the amount of funding that comes to New York State through Medicaid, it's $1.2 billion. New York State is not that much bigger than Tennessee. So we need to stand up for the citizens of our state and say, hey guys, get this letter, get this fixed. So I'm basically making a pitch to you guys to think about putting together a unified message on that. We could go on to the next one. I'm not going to spend a lot of time on this. You guys may be aware, though, that we do have 99 representatives that will be, their offices will be elected on November 3rd, and preponderance of Republicans in the House. In the Senate, we have 33 senators. We're voting on the even-numbered districts. That means districts 28, 30, District 30 and 32 here in Shelby County. That comes upon the third issue I was hoping to come to, which is the issue of physician-led team-based care. And we can go into that as well if you want to move into the next slide, because this is a recurring theme. A number of you, this is one of the medical students several years ago, Mike Bright, who came with me to meet with Representative Steve McManus out here in Cordova. Typically, if we're not in coronavirus, I will set up coffees with state representatives and senators, with medical students, to articulate your perspective on healthcare issues. One of the issues that's being discussed by the Tennessee Medical Association has to do with physician-led team-based care. And as you may be aware, some of the nurse practitioners have suggested that they no longer need to be supervised by physicians, that they should be allowed legally to set up their own offices, their own facilities, and it's called independent practice. None of the southeastern states actually have completely independent practice at this point. This issue has come up in the legislature a number of times. A number of us have chatted with the state officials about the difference in length of training of physicians versus nurses, which is to the ballpark of 7,000 hours after graduation for physicians, as opposed to 2,000 hours for nurse practitioners. And there's a big difference in the amount of training in those additional 5,000 hours of training. And that's why many of the physicians feel that we need to have, if anything, to strengthen physician-led team-based care so that we are working in concert with nurses as opposed to competing with nurses for patient care. So if you want to move on to the next slide. And a number of us have met with both Republicans and Democrats. Advocacy is not tied into which party you're in. It's tied into communicating the needs of the patients in the state to receive qualified, good medical services, and our ability to provide those services as physicians in the state. So I've gotten to know a number of these state legislators, and I appreciate help from the medical students in some of these periodic coffees of chatting with them about issues. Just as a small example, for instance, the issue of revoking Tennessee's law requiring helmet use by motorcycle riders has come up before. And sometimes the state legislators don't realize how important a motorcycle helmet can be in preventing a catastrophic head injury in a motorcycle crash. And that's one of the issues that we've articulated. But if you want to go on to the next slide. And the Memphis Medical Society and the Tennessee Medical Association have been instrumental in allowing some of the grassroots involvement to have meaningful effect statewide. And so it's great for you all to become active members of the Memphis Medical Society and the Tennessee Medical Association, because, excuse me, for physicians to really have an effect legislatively, we need to work in concert with each other rather than various disparate messages that are not well articulated. So we usually do have our day on the Hill in Nashville. The next trip I make up to Nashville will be my 100th since 2005 when I started working with the Medical Society on these issues. So I've been up there long enough to get to know some of the legislators and have some effect. So if you want to move to the next slide. This is currently our county mayor, actually Lee Harris, who was one of the leading state senators several years ago, and some of the other physicians that have helped in articulating these messages. So several years ago, as you all may be aware, Jennings Dooley, who is out of UT here in Memphis, got together a consortium of leadership in the medical students in the other 4 university systems and wrote a unified letter. That's what resulted in that $8.6 million boost in funding for graduate medical education. The same could happen if you guys want to work as a team with the other medical centers and get together a letter to Lamar Alexander and Marcia Blackburn and say, we're very concerned. We want to see that graduate medical education is properly supported in the state. It's a priority. So if you want to move on to the next slide. And this is my wife, Kathy Chapman, with one of the other rheumatologists and our former Senator Bob Corker. And we also chat federally with the representatives and senators there. So if you want to move to the next slide. Everybody needs to vote. So at the very minimum, you want to learn who is your state representative, because you have one that represents you, and who is your state senator. I'm talking state, I'm talking Nashville. All of us have one senator, we have one representative. The senators are voted upon every 4 years. We're currently in the process of getting ready to vote on the even numbered districts on November 3rd. And early voting is starting, I think, October 17th, so very soon. And we all of us have one state representative. And at the very minimum, it's a good thing to figure out who your representative is. You can go to the Shelby County Election Commission, plug in your street address, and it'll tell you who your state senator and representative are. And that's the first step in becoming more active. If you want to go on to the next slide. This is my staff, and I'm just honored to have an opportunity to share a perspective on these things. And I see there's a couple chat comments and questions. I'm going to endeavor to navigate to those here. Let me see if I click on chat here.
I can read them if you'd like.
Oh, sure. I see. Okay. Let's see here. Okay. Okay. There's let's see here. How much is funding growth for graduate medical education still limited by the Balanced Budget Act of 1997's residency cap, and how much more room for growth is there in the state's contribution to future GME funding when compared to other states? Funding comes through several different sources for graduate medical education, and of that $205 million total cost in direct cost, $50 million has been flat. And what we really need is we need an updated formula for GME funding. I've spoken with Len Marquez up at the American Association of Medical Colleges a number of times over the years. And what Len tells me is he's like, Dr. Woodbury realized that the formula for TennCare funding is individual to each individual state. And it was negotiated separately back in the late 90s. And so if you know the formula well for one state, that's all you know, because you can't even, if you know Tennessee's formula, you might not know Mississippi's or Alabama's. They're all very different. Like I mentioned earlier, New York somehow managed to achieve a $1.2 billion formula for funding, whereas we've been stuck with that same $50 million since 1997. So our existing formula in and of itself was toxic to the state. Our population has grown from 5.4 to 6.8 million. We have the same 50 million through TennCare that we had in 1997. And the original formula needs to be renegotiated, but especially important is to see that that money is not taken away, because that would result in loss of graduate medical education positions. Funding, the state is quite capable of establishing a line item in the budget. The Tennessee budget is to the tune of about $31 billion. That's 31,000 million. We're talking what's coming from the state for graduate medical education through TennCare is 16.6, and even that 16.6 million I said million, not billion. 16.6 million comes from a tax on all the state's hospitals. So it doesn't currently come out of the state budget directly. The $8.6 million boost that was achieved a year ago, January, came as a line item out of the state budget. And the state legislators, if they become aware of this issue, that this GME funding is important, they could easily request that Governor Lee put in the budget that he will present in January a line item to boost funding for graduate medical education so that we can grow these residency programs like we need to grow them. So there is a lot of room, and it's determined by state legislators talking with their leadership. And that's where you come in. If you figure out who your state legislator is, you can raise the level of priority of this greatly if you call their office or if you send them an email and say, hey, you know, GME funding is important. We are the doctors of tomorrow. We can't afford to work for free. We have debt. You know, we want to be trained in this state, you know, so you can have a big effect on this. As a matter of fact, one of the senior state senators said to me, he's like, Dr. Woodbury, you're not coming up here to talk about GME funding with me again, are you? I said, well, of course I am. Well, he said, well, quite frankly, this issue is not going to get fixed if it's just you. It's going to require medical students and residents and fellows getting together, writing a coordinated letter and showing us that they know that this is an issue. If you guys show that there's an issue, you better believe it can be fixed very quickly. The next question was, has there been any legislative progress for the Resident Physician Shortage Reduction Act, bipartisan effort to increase residency positions nationwide? The pace of the federal initiative has gotten bogged down a number of times, and sponsors do surface for that Resident Physician Shortage Reduction Act, but unfortunately it has not moved forward in an active way as of yet. But that would be a good thing to expand funding federally for the whole country. The one problem with the Resident Physician Shortage Reduction Act is what states do you think are going to eat up the lion's share of the funding? It's probably going to be apportioned to New York and California and Florida, which is where a lot of the funding is going now. So in terms of Tennessee and the short-term future, we could achieve a lot more through our state budget by boosting funding for GME through the state budget, in my opinion. And the Residency Physician Shortage Reduction Act is important, but its pace of coming to passage has been unfortunately slow. So that is an important point, though. And someone has a question too. According to HHS, each residency costs about $100,000 in funding by Medicare, primarily state governments, Medicaid, and CHIP. Can you help to explain why the per resident cost is so high? Why does $100,000 account for? Well, that $100,000 includes both direct cost and indirect cost. Direct cost is the actual salary plus the health insurance of the resident being there. Indirect cost could include the secretary that works in the department to answer the phone when someone calls, or support for the application process of people coming into the position, a lot of other ancillary expenses that are being put into on top of the cost of having the actual resident there. So that's what's called indirect funding. And so that's why it's 100,000 as opposed to closer to 70,000. My daughter tells me in New York State, I think it's closer to 90,000 for direct cost, 92,000 because of the higher cost of living up there, because she's up in New York City. But it'd be, and like I say, there's a formula that's used by Medicare for funding graduate medical education, and also the hospitals themselves. That's called an overage. So for instance, say Methodist Hospital here in Memphis, they may say we need more neurosurgeons than we have, but we're under a static formula that's coming from Medicare and a static formula from Medicaid or TennCare. So why don't we just fund an additional residency slot, and we will take the money to fund that spot from revenues that the hospital earns from commercial payers. And so that's called an overage. The problem with that is if the economy changes, the hospital may have a tendency to want to cut some of those slots. So that may be an issue. Theoretically, if GME funding is cut, what would residency pay look like? Well, if it is cut to a large extent, it will possibly result in some of the residency slots being lost. That's why it's really important for us to support this. And my personal opinion about this is that it's good to act upon this issue now rather than after the elections, because even though Senator Alexander is fixing to retire in January, he has a significant leading role in Washington, D.C. relating to education. He's the chair of Health, Education, Labor, and Pensions. If he would see this as a priority to get this fixed, it's quite likely he could talk with the people at CMS and it would be fixed pretty quickly. So he's, because of his leadership role, whoever comes into his office to replace his position will be a junior senator and will not have that level of impact. The residency pay per slot would probably look the same. We have approximately to the ballpark of about 600 some PGY1 slots in Tennessee, 650, 680, somewhere in that ballpark. And so it would probably affect the number of residents we could have in Tennessee if on July 1st, if all of a sudden that 50 million dries up. As a Biden victory looks more likely in the polls, can you share your perspective on how a public option, if implemented, would impact our healthcare system in your opinion? My opinion is that there are a lot of questions to be sorted out and answered, even if the administration changes in January. And I don't know myself regarding how that will sort out. What we have seen with Obamacare, I've been practicing for 28 years, is unfortunately we've seen certain people achieve insurance, but with very high deductibles. So for outpatient care, like what I do is just about exclusively outpatient. Deductibles are now $2,000, $4,000, $6,000. And so even with insurance, people could be undercovered or underinsured. So there are many questions that have to be sorted out. And how has COVID affected the discussion around this issue, considering the fact that medical trainees are on the front lines? I think it's all the more important that those 6.8 million people that live in Tennessee have adequate physicians now, but also physicians in the future. So we can't afford to lose you guys when you graduate to other states. And so I think COVID would underscore, if anything, the importance of supporting graduate medical education. And the next question has to do, is this part of the reason for the residency contract being dropped with Methodist? That I don't know the intricacies of that particular issue to be able to comment upon that issue, but we did have it here in Memphis. We had a training program at Christ Community until about 3 years ago for family practice with 5 residents there, and the funding was unfortunately cut off abruptly, is that when they were senior residents. So 5 residents that were going to complete training at Christ Community had to go to other states when they were halfway through their last year. So funding is a real important thing. So it's really good for medical students to join together and put together a unified voice, perhaps a unified voice separate from the Memphis Medical Society and the Tennessee Medical Association, perhaps your own voice. You know, you could speak up almost more to the mindset of a union or a guild or a, you know, an association, whatever you want to call it. But I'm just saying you guys need to be a priority for both this issue and in general for all medical issues, you know, because you're the doctors of tomorrow. So I'm kind of, Clint Cummins is going to get mad at me, but I'm saying it's a good thing to for you guys to have a unified voice and to speak up, because your needs are our needs, and we should all of us realize that. But you guys have been a great audience. I'd be happy to go into more detail with you all on any of these issues, and if, for that matter, if you want to pick up on other issues down the road, we could certainly do a follow-up at some point. I'm kind of a little bit of the crazy advocacy guy, because I work on some of these issues almost every day or every other day. But at the very minimum, what you can do now, since you're busy people in your medical school training, is figure out who your state representative and senator are by going to shelbyvote.com, SHELBYVOTE.com. If you're registered, vote in the November 3rd election. If you're not registered, get registered. And become better informed about the issues, become a member of the Memphis Medical Society and the Tennessee Medical Association. I don't know if you all have other questions.
Dr. Woodbury, are you looking in the Q&A questions as well, or are you just in the chat?
Oh, I'm in the chat. Let me see.
Okay, there's
better
one
go
new
in-
one. I'll put it in here for you. That way you don't have
Okay.
to try to maneuver around.
Let's see, Dr. Weber, could you repeat what the proposed budget cut is, and would the budget cuts reflect in the salary amount or in the number of residency positions? What has happened is, as of the last month or two, the administrators at CMS have said we will completely cut off funding our 2/3 of the 50 million that we're supposed to be sending you all July 1st for Tennessee through TennCare. And that will result in problems for residency programs in University of Tennessee, Health Science Center, Vanderbilt, Meharry, and ETSU, Eastern Tennessee State University. It's likely those salary amounts would stay the same, but it's likely that those programs would have to adjust or cut some of those positions. But this can be so quickly fixed if these elected officials will talk to the administrators at CMS and say, hey, y'all get busy. I can bet you 10-1 that Lamar Alexander knows those administrators that are behind this unfortunate decision that they made in Washington. And I do not think that the solution to this needs to be quietly discussed between TennCare and CMS. It needs to have input from the people that it really impacts, which is you, if you're thinking about staying in Tennessee. So that's why I'm telling you guys about it. Think about putting together a little letter. And actually, we can share the letter that I wrote about this issue. Clint Cummins has a copy of it, but he could perhaps send it to you. You can answer individually, but you'll have much more of an impact if a number of you call those offices and say, hey, GME funding is real important to people in Tennessee. Theoretically, if GME funding is cut, what would residency pay look like? Residency pay would probably stay the same per position, but some of those slots would be lost, most likely, in my opinion. And that's really unfortunate for this state, considering it was raised by several hundred million dollars by New York State several years ago. And here we are scrabbling around talking with CMS about 33.3 million, and we're not that much smaller than New York State. So I'm not trying to build a grudge between Tennessee and New York, but Chuck Schumer actually probably talked with the people at CMS and say, hey, we need to make some adjustment here. And I think we in Tennessee need to stand up and say the same. I think I've gotten your questions, and Sarabi Rao is our medical student coordinator. And if you all want to chat further about this issue, I'll be happy to visit with you or come down to the university and chat with you. I'm not a official, staff member at the University of Tennessee, but I'm happy to come on the campus and share a perspective on this. The strength for physicians comes in being well organized and working more collectively as opposed to individually. And believe me, this GME funding issue can be fixed pretty quickly with proper focus. So, but you guys have been a good audience. Let me make sure I'm not missing any other questions.
I'll throw in a couple of plugs if there's any last minute questions, people can type them in, but a couple of plugs for future events that we have going. First of all, as if Dr. Woodbury hasn't done enough, tomorrow afternoon, he and I are going to spend about 3 hours interviewing candidates for the general election via Zoom. We did some of that during the primaries, and now for some of those positions that we missed, we're going to finish up with the general election. Those will be published on YouTube when they're finished later this week. Just trying to help you guys and the rest of our members make informed decisions about who they're going to vote for. So nonpartisan interviews, all the candidates will be answering the same questions. And again, just trying to do what we can to get as much information to our members as possible. We'll try to get that to you by the end of this week. As Dr. Woodbury said, we'll send a form letter that you guys can send to your elected officials. And you really can't overstate the value of younger voices being part of these movements. Dr. Woodbury is great. Our elected officials always listen to him, but when his voice has more voices attached to it, it's going to be even more effective. The next event that we have for students, you all should be getting an email about this. So we've done some money in medicine classes for you all. And so we're doing another one that I'm quite excited about. This is actually going to be a panel of physicians answering live questions. And we'll give you a mechanism to send some questions in advance. That's going to be Monday, October 26th. You should be getting an email both from us and the university about it. So I think the university might be making it mandatory, but don't let that deter you. We're going to be moderating it and going to try to keep it as upbeat and fun as we possibly can. And hope to see as many of y'all as we can there. Dr. Woodbury, anything else?
I would say about this GME funding issue, there was one question that came through: what's the best place to see a state-by-state breakdown of GME funding? You have to unfortunately do a fair amount of research, but the AMA supports on their website a Support GME Now. I would suggest going there to look for that information on GME funding. It's actually kind of a complicated formula because it comes through Medicaid and Medicare and the hospitals themselves and the VA system, but it's possible to find that if you delve in there. What I would say about this whole issue is many of these issues in organized medicine can be fixed very well by coordinated, unified voices. And so be energized, because you guys are the future. You guys are the doctors of tomorrow. We need to support you because we really need you, and we don't need you to run off to Texas or something. So it's great having you in the audience, and stay tuned.
All right. Thanks everybody for joining us today. Thank you, Dr. Woodbury. Thank you, Allison and Cara. Hope you all have a good rest of your week, and we'll see you at an upcoming event.